Imagine if it was possible to predict and avoid unplanned admissions simply by measuring someone's temperature. Channel 3 Consulting and NHS England are working together to make this a reality. I'm Eleanor Rollison, a partner at Channel 3, and my colleague Steve Curd and I are going to tell you about a pioneering remote monitoring research programme being sponsored by NHS England and the huge opportunity it represents to support the digitisation of the NHS and social care. We're all aware of the unprecedented demand on health and care services, even before COVID, and the need for us to establish new models of care to meet this demand. Our research in 4 CCGs is focused on transforming the delivery of care to patients with multiple comorbidities. Using data collected from wearable technology, we believe it's possible to revolutionise the way we manage and treat these chronically ill patients. The remote monitoring market is complex, with many products offering seemingly similar benefits. Channel 3 and NHS England are working with 4 technology partners to bring innovation and imagination to the way these latest remote monitoring technologies can be used to collect vital signs data. Our technology partners have selected various sensors to use in their research, so we're also building knowledge of what works best in different care settings and, crucially, how to support patients effectively when they're being monitored.
Each project is testing the same hypothesis. Put simply, can vital signs data collected with monitoring technologies predict the demand for services arising from patients with long-term conditions? And if so, how do we then reconfigure local health services so that they can benefit from it? The project teams will compare their vital signs data to unplanned GP and hospital attendances recorded in the participants' health records. It's a controlled research programme, so there will be no active interventions in participants' care while we're collecting data. However, using the evidence we build, clinicians will be able to intervene to make patient care more effective in future. The teams will use advanced analytical techniques to spot predicted patterns in the data that are currently unknown. Channel 3 is supporting the 4 projects in recommending to the NHS how these insights are turned into new care pathways for long-term conditions, where unplanned attendances are greatly reduced through early intervention. In West Essex, L2S2 are recruiting participants from care homes and GP surgeries. Their chosen devices collect a wide range of vital signs data, supplemented by questions about participants' diet and movement that are recorded in a smartphone app. They expect to find better ways to care for very frail and comorbid patients. DOCLA give the programme a secondary care dimension. They're working with Northampton General Hospital to identify cardiology in patients at the point of discharge. Participants then wear an adhesive patch and an armband that record a range of data for 1 to 2 weeks. This project will provide a real insight into a group of very medically unstable patients and hopes to reduce readmission rates. Luton CCG has partnered with Babylon Health to recruit the largest cohort in the programme, 1,500 participants. They're using medical devices to record key vital signs, including temperature, once a day for 2 weeks. After that intensive burst, other data will be collected continuously for a longer period using a smartwatch. It's this project that's seeing whether temperature alone indicates a risk of ED attendance. Philips Healthcare are asking Lincolnshire care home residents and GP patients to use a tailored range of devices, including an app that measures vital signs using a smartphone camera. Like L2S2, they expect to find ways of detecting deterioration in frail patients much earlier than is currently possible. By collecting vital signs data and finding patterns that indicate deterioration in patients' health, this research will create important insights for clinicians rather than just layering in more technology to check. This will lead to new, digitally enabled care pathways that improve patient outcomes, give patients greater understanding of their long-term health conditions, and minimise unplanned care attendances. Through this work and our other engagements, Channel 3 knows that wearable technologies like these work best when they're built on 3 foundations: evidence, clinical buy-in, and patient engagement. The Proof of Concept research programme brings all of this together. Thank you for listening. If you want to find out about how we're making digital health and care happen, feel free to contact any of the team at Channel 3.